Welcome to Learn to Live Stress-Free. This is Christine Wright with Dr. Robert Wright, Jr., your go-to wellness coaches of www.stressfreenow.info. Our featured guest today is Dr. David Clarke, speaking about the causes of anxiety and how to get better. Dr. David Clarke is president of the Psychophysiologic Disorders Association and is a clinical assistant professor of Gastroenterology Emeritus and Assistant Director of the Center for Ethics, both at Oregon Health and Science University. He is board certified in gastroenterology and internal medicine and practiced in Portland, Oregon from 1984 to 2009. Dr. Clarke has received numerous awards for excellence in patient care. He received his BA in psychology from Williams College, Phi Beta Kappa, and his medical degree from the University of Connecticut in 1979. Since then, he has successfully cared for thousands of patients with stress illness, often sent to him after other doctors were unable to help them. He has been a visiting professor at Oxford University Hospital in England and at the Royal Children's Hospital in Brisbane, Australia. He was twice named a top doctor in Portland Monthly magazine. Dr. Clarke is the author of They Can't Find Anything Wrong, and his book has been featured in several magazines, including Elle. For his own stress, he prescribes playing indoor soccer, photography, hiking among mountains, adventures with his family, and his wife's cooking. He lives in Happy Valley, Oregon, which is near Portland. Dr. Clarke also has a website and blog called The Stress Checkup. Dave, welcome. We're so happy to have you on our show again today.
Thank you. Delighted to be with you.
Yes, Dave, we're so happy to have you back. You know, the last time you were on our show, you hit it out of the park talking about psychosomatic illness and how real it is and what can be done. Now you're here to talk about anxiety and how people can live a better life by dealing with it and recognizing it and doing something about it. So, Dave, according to the National Institute of Mental Health, 18% of all adults in our country have some serious type of anxiety disorder, such as obsessive compulsive disorder, otherwise known as OCD, panic attacks, social anxiety disorder, or PTSD, or which is known as post-traumatic stress disorder. That means that 40 million Americans or more have some form of serious anxiety disorder. Why do you believe such a high percentage of people are wrestling with anxiety in our society?
Well, that's a great question, and I think at least part of the answer is that there are so many different causes of anxiety disorders. Part of it is likely to be biological. The brain is a flesh and blood organ like any other, and it's therefore subject to biochemical imbalances, and that can certainly cause anxiety in some cases. There's also the issue of adverse childhood experiences. We are coming to appreciate the impact of those more and more. This might be abuse, neglect, violence in the home, substance abuse by the parents, any of a number of adverse conditions that can happen in a home when a person is young that can lead to anxiety in adults, often many years or even decades later. So when you add all those up, it's not surprising that that many people suffer from anxiety.
It's so true, Dave. That is so true. Bob and I think in our readings, we came across something from Harville Hendricks and Helen LaKelly Hunt, and they speak about what you just mentioned, something that happens in childhood that the adult doesn't remember but is wreaking havoc on how they're living their life, and they're not aware of it. I mean, one story they told was a child who didn't like a particular aunt, and the reason was when the parent was having the new baby, they went to the aunt's house, but they were asleep. So they woke up, and their parent was there, and they were with the aunt. They didn't know why. And the scent of the perfume caused some memory, and there was no real reason not to like the aunt other than this childhood incident. So when you talk of something happening that we don't have a conscious memory of causing of anxiety, that just came to mind for me.
One of the things that has occurred to me when Christine was talking was the story in Helen and Harfield's book, Getting the Love You Want, which is a pretty famous book. And I was thinking of most people have some story like that. I remember a client who had an anxiety issue, and I gave a hypothetical situation. I said, because I was trying to describe why a person might have an unconscious memory, but they're not consciously aware of the source of their anxiety. And I said, imagine a baby in a crib that's in the room, and then the parents are in another room arguing. So the baby can hear that arguing, and then all of a sudden the TV falls off the shelf and there's this large boom. So the visual would be the baby's in the other room, and then the baby would hear the boom, and then, an infant in a crib, you can imagine it for a moment, it would be startled, and then it would make some fast movements and then start to cry. And I said to the person, I said, that makes sense. They said, oh, yeah, anybody can understand that. I said, so now that baby is an adult, they're 25 years old, they're walking down the street, and they hear a large boom, right? And they freeze and maybe start to cry. And so there's no conscious memory of what happened to them in the crib. Why would this sound be bothering them? And so that has always been a very interesting aspect, at least for me. And so what I was thinking is adults have a lot of anxiety, but I'm thinking today with what's going on with social media and especially the bullying in the last 2 to 3 years that's been all over the media, I believe that children may have even higher levels of anxiety than adults. What do you think about that possibility?
Well, there has been some research in that field, but there are a lot of differences in the methodology in those studies, and so the results that they get have been somewhat all over the map, but there's no question that at the very least anxiety levels in children are in the same ballpark as we see in adults. And it may be that the bullying that we see in schools and the social media pressures and just the schoolwork pressures, they all create their own sources of anxiety that adults don't necessarily suffer from. So that could easily account for why anxiety levels are comparable. One of the things that I look for also in my adult patients is, did they go through a series of experiences that were stressful when they were growing up? One incident of a loud bang is going to trigger your fight or flight system. But if it's just, an occasional isolated incident, that likely is not going to be enough to contribute to an anxiety disorder in an adult. But if there are regular, unpredictable, toxic stresses going on, then the odds of you developing an anxiety disorder later in life will go up. Many of my patients have grown up in environments that resembled a minefield where one day you might walk through your life and everything's fine, but then the next time something blows up in your life, and you can never quite tell when one of those bad episodes is going to happen. And so you have to be constantly on your guard. And that's a situation that is almost guaranteed to produce an anxiety disorder at some point. I can also make the comment about children that self-esteem has a lot to do with your vulnerability to bullying. If you have a very strong sense of yourself, if you come from a home where you are made to believe in yourself, where you get a lot of positive support from the authority figures in that household, then you're going to go off to the school environment with a good sense of your worth as a human being, so that when somebody tries to bully you, it's pretty much just going to bounce off. If, on the other hand, you come away from your home environment with a sense that you're not measuring up in some way, that you're a second-rate human being in some way, then when someone at the school tries to bully you, that's going to be reinforcing that. And you're going to be vulnerable to that. And when the bullier recognizes that in you, they're going to see you as a worthy target for their efforts, and a vicious cycle may begin.
Well, thank you so much for that. And in fact, Dave, you've opened the door for us to do another podcast because we had done actually unintentionally, or as the master said in Kung Fu Panda, there are no accidents. We've done unexpectedly maybe 5 or 6 podcasts on the subject of bullying, and that wasn't our intention, but this issue just keeps coming up. So I heard very clearly, and I believe our audience heard very clearly what you said about the bullying, about the self-esteem, and I believe also the self-image plays a key role. But let me just ask you this quick question. What about when the bully is inside the home? The bully is a parent, and the bullying could be, something obvious where, as you're saying, physical abuse, the parent, or verbal abuse. But how about this as a form of, even I find this type of example I'm going to give it even more insidious in terms of depressing a person and possible being a source of not just stress but anxiety. The child comes home and got a 97 on the test, and the parent, instead of saying, "Good job, this is fantastic, great, the parent says to the kid, "What happened to the other 3%?"
Yes,
right. So
you're so right. The common denominator that I see in my patients for whom childhood stress was an issue is treatment of the child that makes them feel like a second-rate human being, that knocks their self-esteem down, their self-image down on a long-term basis. One of the more dramatic examples of that was a patient of mine who was hospitalized because she was having bowel troubles, and she had lost 87 pounds over 18 months. She dropped from 200 down to 113, and the diagnostic evaluation was entirely normal. And it turned out that when she was a child, it was her mother's habit at every evening meal to talk to her 2 daughters, one of which was my patient, about what was wrong with them and what they needed to do to improve. Now, you have to imagine that happening night after night after night with this child, with very little in the way of positive support or praise going on. It was always about, here's what you did wrong, here's what you need to do to be better. So now we flash forward to she's an adult. She's in her early 30s. She has a 2-year-old child. And when the child was 6 months old, which was 18 months before I was seeing this patient, which was exactly when the illness began, it turned out that was when the mom started coming to visit. And no surprise that when the mom came to visit, she would talk to her daughter about what she was doing wrong as a mother. And on top of that, she would be saying, here's what's wrong with your little 6-month-old baby and what it needs to do to improve. So it was recapitulating what amounted to emotional and verbal abuse that this woman had suffered as a girl. And so she was in a place where when her mother came to visit, she didn't know whether to give her mom a hug or drop kick her off the front porch. And, emotionally, all those emotions were going down into her GI tract and affecting her appetite. She started losing 5 pounds a month, and 18 months later, that's when I was asked to see her. And by recognizing this very clear chronological connection between her illness and the times when her mother was coming to visit and being, again, verbally putting her down, she was able to see that connection. She was able to take the bull by the horns and deal with her mother in a more positive and constructive fashion and refuse to be essentially bullied by that mother any longer. And it was then that her symptoms finally stopped.
Incredible story, Dave. What you're saying gives validation to a thought I had early on in my life. In graduate school, as I was doing my teaching, I said, if we fixed the issues in childhood, we'd have so many fewer maladies in adulthood. the structure of society and life is such, and this is all meant for the good to improve ourselves, there's a great deal of judgment. It starts in the home, as you said, with this parent telling your patient what you did wrong and what you did right. Your parents are maybe judging you, your teachers are judging you, then you get to work and your employer is judging you, your coworkers are judging you. And you talked a little bit about, the anxiety that we have from test taking, and Bob was talking about the social media pressure. It's not just in childhood and the bullying in school, it's across the board. So with all these environmental factors and stressors from technology, media, just day-to-day living coming at people, Dave, when does someone know that their anxiety or their stress is at a level where they should see a doctor or a therapist or a professional coach? What are the warning signs that the feelings of anxiety and symptoms may require professional help to overcome?
Well, I think it gets to that point when it's starting to interfere with your life. When you're starting to get to the point where your activities that you would like to do are being affected by the anxiety level, where you're avoiding doing things that you would normally enjoy doing because you have worries, anxieties, tension, nervousness, fear, whatever you want to call it. An example of that was a patient of mine who essentially, whenever he left the house, he would start getting physical symptoms that would just grow and grow until they reached the point where he had to go back home. The home was a safe environment for him, and he didn't feel those symptoms when he stayed home. But as soon as he left, and certainly the more people that he found himself around, the worse those physical reactions would get. So if you've got, it can be hard to sort of step out of yourself and look at yourself objectively. So another way is if you've got people that care about you, and they're telling you that your nervousness or fear or anxiety are out of proportion to any reason for those feelings to be there, that would be another reason that professional help might do you a lot of good.
Yeah, I think very definitely. Thank you so much for that. This is a fantastic conversation here. Audience, we will be back in a moment to continue our talk with our featured guest today, Dr. David Clarke, on Learn to Live Stress-Free.
Hi, I'm Dr. Robert Wright, Jr., the Stress Relief Doctor, co-host of the Learn to Live Stress-Free podcast series. I'm an author, speaker, and stress management wellness coach. My published study is the first to show the connection between stress reduction, grief recovery, nitric oxide spiking, and the relaxation response. And my practical application of this knowledge helps you relieve the stresses of everyday life. I have the tools to dissolve your pain points quickly and effectively. Email me to find out how you can start to feel better now at stressfreenow.info/contact. That's stressfreenow.info/contact. Have you been procrastinating about completing an important project or pursuing a treasured dream? Christine Wright specializes in helping her coaching clients to lay out clear, elegant strategies. She shows you how to quickly build your confidence to uncover and eliminate your habitual patterns of resistance and self-sabotage. Christine helps you discover those meaningful insights that will get you to do what works so you can celebrate your successes. Go to stressfreenow.info/contact to let Christine know that you're ready to live your ideal life now. Again, that's stressfreenow.info/contact.
Welcome back to Learn to Live Stress-Free, and we're continuing our discussion with Dr. David Clarke, our featured guest today.
Dave, before the break, you mentioned two key words which resonate with me, and I believe that would resonate with our listeners, and those two words are fear and anxiety. And so to some people, those two things are the same, and to others, they're different. For our listeners, can you just briefly talk about what you believe and know as what the causes of anxiety are, and then how is anxiety related to either conscious or unconscious fears?
Sure. I think the symptoms of anxiety, the internal fear, sometimes the palpitations of the heart, sometimes dizziness or shortness of breath, those things can sometimes have a biological explanation. I'll always remember very soon after I got my medical degree, the person who lived in the apartment downstairs from me consulted me in the hallway about physical symptoms that she was having that seemed to be anxiety related, but I discovered that she was polishing off a full pot of coffee every morning, and when she took that, down to a more reasonable level, the symptoms that she had just went away. So excessive caffeine, overactive thyroid, abnormal heart rhythm, those sorts of things should be checked out in people that are worried about having an anxiety issue. But barring those things, then we're usually talking about a source of fear that person may be consciously aware of. There may be an identifiable reason for it. For example, one of my patients was the victim of an assault. The person who assaulted her came from a Southeast Asian country, and whenever she saw anybody who physically resembled him, the anxiety levels that she experienced went way up. So that was a clear connection to a source of fear that she had. But other people, the fears are not so obvious in terms of what their source is. And here again, for many of those people, they simply grew up in a high-tension environment. It might have been that they were worried about being abused in some way in their childhood household, or it could be, just the verbal comments that we heard before about people having their self-esteem knocked down. Any environment that resembles that minefield where, yes, some days go by just fine, but other days bad things happen and you can never be sure when one of those bad things is going to occur. That just simply raises a person's a stress response level to a much higher level than any child should experience, and that carries on into the adult years. So lots of links and connections there, lots of things to consider, but most of the time we can uncover sources for these symptoms.
Great, Dave. I think what you said is so wonderful and descriptive of the experience of anxiety that many people have, and that can be encapsulated in the phrase of walking on eggshells. As you said, they don't know if when they come home the response is going to be, oh, I have cornbread in the oven waiting for you, a nice apple pie, or it's that just wait till you get in here and I'm going to give you a piece of my mind. And so that it's the not knowing, it's the uncertainty. The person is walking up to their porch and they need to smoke a cigarette because they go, oh my gosh, okay, when I go inside, I don't know how she's going to be or how he's going to be, or that kind of thing. And then when I want to make a joke out of it, I think of the Flintstones when Fred would come home and Dino would attack him, and he'd say down Dino, But fortunately, that was a friendly type thing.
Yeah.
That's what I was thinking, that walking on eggshells feeling, that is like a serious anxiety feeling.
Yes, and it's a perfectly normal response to an abnormal environment. This is something that I talk to my patients about all the time, that there are physical symptoms that seem to have no diagnostic explanation, and certain behaviors as well. Drug use is often self-medication for the emotional consequences of past abuse. Eating disorders are a reaction to previous chaos in the person's life. And self-mutilation or cutting behavior is also actually a coping mechanism for past stresses. So important to recognize that many of these phenomena that we occur in people's lives that we look upon as abnormal or difficult or a disease are actually perfectly normal reactions to very abnormal environments.
Well, Dave, thank you so much for that, and it just amazes me how many doors. I feel like I'm on The Price is Right, and they're saying, do you want door number 1, door number 2, door number 3? I mean, look at the doors you just opened. Eating disorders, how huge an issue is that as a source of anxiety? Addiction, and what's really going on there? And then, of course, we know bullying, but I think you hit on something that is actually a taboo subject in our society. Cutters or people that are cutting themselves because that appears to be the only way they can feel something. At least that's one explanation I've heard. So the things that you just mentioned, well, I just letting the listeners know, we hope in the future we'll have you back on to talk about these topics, because certainly cutting a person's self-mutilation, and I would like to know, is there any relationship to that and all the tattooing that we're seeing in our society?
Well, the tattooing, I have to bail out and say that I'm really not an expert on what goes on behind that, but absolutely the cutting, the eating disorders, and the drug addictions and abuse, for many people, these are simply coping mechanisms. People tend to look upon these with shame. They feel badly about themselves for indulging in these activities. But if they fully understood the roots of these behaviors, that they are often direct outgrowth of enormous levels of stress that they've been subjected to earlier in their lives, then they can look at them as survival techniques, as methods that people use when they are fighting really to live. The alternative for many people is to give in to the overwhelming despair that is frequently the accompaniment of childhood stress. But instead, these are people that are resorting to whatever it takes to keep on living and keep on trying to heal. So I have tremendous admiration for people that fight that hard to get through the difficulties that are essentially no fault of their own. I tell many of them that it's as if they were born on the far side of Mount Everest and they've had to climb up and over to get to be an adult, an independent adult. And that emphasizes that they bear no responsibility for the environment they happen to have been born in, but they should take tremendous credit for having climbed up and over that mountain to get to where they are when I'm seeing them. And that's a 180-degree flip in their self-image that I truly want them to have. I want them to look with pride on what they've overcome.
Well, Dave, that is, whether we call that a metaphor or an analogy, that is so beautiful, and it syncs well with our view here at Stress Free Now of one that's positive and hopeful. So I want to just move, as we wind down our interview here, I want to ask you about the amazing book that you wrote entitled They Can't Find Anything Wrong, 7 Keys to Understanding, Treating, and Healing Stress Illness. I know when I went to Amazon and looked at your reviews, the reviews you've gotten on your book are amazing. Would you tell our listeners why you wrote that book and what it's about and the stress solutions you offer readers in your book?
Well, I wrote it because, in the United States alone, there are approximately 40 million people that at one time or another suffer from stress-related illness, brain-body disorders, psychophysiologic disorders, and very few healthcare professionals that have had any formal training in how to diagnose or treat it. So I wanted to put something out there that people could use to help themselves. And the heart of the book is about 4 dozen case histories of patients that I've seen, selected from the over 7,000 that I've worked with. And these 4 dozen are designed to illustrate the spectrum of different kinds of stresses that can make people physically ill. And my hope is that a reader will find at least a couple of those stories that resonate for them personally, and they can then use the treatment recommendations to begin their own healing pathway.
That is just truly a great service and a great gift, your book and your body of work, Dave, because I think part of what Bob and I believe and what you're also saying in this conversation is that the default state of the human being is health and well-being. And we can be put upon in so many ways that this will cause these psychophysiological disorders, and that there's a real relationship between it. As resilient as human beings are, and as much as we strive for health and wellness, there's also an aspect of us that is very delicate and very fragile, and that needs to be paid attention to. One of the other things that you offer, Dave, is the free download of on your website of the hidden stress test. Could you tell our listeners a little bit about that test and how using that can offer insight into relieving their habitual levels of stress?
Yes, on stressillness.com, if you click on the book overview tab at the top of the home screen, it'll take you to that screening test, which is approximately 9 questions that are designed to try to uncover the main sources of hidden stresses in people's lives. It's certainly at 9 questions, it's not going to be comprehensive. It's not going to find every single possible cause of hidden stresses, but it's going to cover, for 9 questions, quite a large number of them. And then there's interpretive information below the questionnaire that will help people make sense of their answers and give them some direction about where to go next. So it's my attempt to help people get some insight into the hidden stresses that might be responsible for their symptoms.
Excellent. I think that's a great tool because awareness really is key. You've spoken about having that ability to objectively step back and observe yourself. So certainly the test that you offer on your website is a great help for people to see where they are.
Thank you.
Great. Dave, in a different conversation, you brought up this issue of ACEs, or which stands for Adverse Childhood Experiences, and I know that's the kind of thing that could probably make the board light up, which is that who hasn't had an adverse childhood experience? And so in our conversation, I was looking to see how that specifically relates to anxiety, and then how could any traumatic childhood event adversely affect well-being from an epigenetic standpoint. So could you just tell our listeners about ACEs and how it relates to anxiety and how that measure or scale can be used from your perspective?
Okay, well, we could certainly do an entire podcast just on ACEs, but for your listeners who are interested, probably the best way to get into that topic is to look at the ACEs Too High website, which is ACEstoohigh.com. And on that website, the full 10-item questionnaire for adverse childhood experiences can be found, and people can administer that to themselves and get interpretive information and get their own ACE score. And as you point out, it turns out that a lot of people have these. Surprising to me how many people have them. At least 87%. Oh, I'm sorry, I'm wrong on that. 68% of the population has at least one, and 87% who have at least one have 2 or more of these ACEs out of the 10 that are measured in the standard questionnaire. And about 15% have 4 or more, which is a huge burden of stress to put on a child. And there are profound long-term consequences that last well into the adult years. The original study looked at 17,000 patients. This was published in the late 1990s. And the average age of those patients was 51 years old. So these were people who were decades removed from the stress they had suffered as children, but it was still having major effects on their health and well-being all those years later. And one of the effects was an increase in anxiety disorders. And what happens is those early experiences turn on the fight or flight nervous system, and that nervous system never gets a chance to get turned back down because the source of the anxiety is ongoing, typically for many years. There's a great TED Talk by a pediatrician named Nadine Burke-Harris, where she talked about the value of the fight or flight nervous system. If you're, confronted by a bear in the woods, it's going to help you survive that encounter. But then she says, well, what if the bear, what if you're not in the woods, you're at home, and the bear is coming home from work every night? And then, you don't get a chance to escape. And that plays into anxiety disorders that can last for years or even decades.
Very true, and I think that's a hard road that far too many people are walking, where the source of the pain and the distress and the anxiety is the person in your home, another person that you're sharing your home with.
Yes.
Well, Dave, we just have so much material for so many more podcasts. As we line up a podcast on ACEs, I think it ties so much into one of Bob's favorite topics of existential grief. And I think when that thread plays through lives, those percentages you gave, 67%, 87%, that's really significantly high. And I'm so glad that you're there, that you've done the work that you're doing and continuing to do it, and that more physicians learn about this relationship of the psychophysiological to illness and wellness. So we just really want to thank you for being with us here today and sharing your time with us. And if you could again, Dave, just offer your website and your contact information for our listeners.
You bet. The website is stressillness.com, and my email address is drdave, DRDAVE, @stressillness.com.
Okay, great. So listeners, just check out all of Dave's information and resources at stressillness.com, and also email him with any questions at drdave@stressillness.com. And Dave, the website you also mentioned, if people want to learn more about ACEs, I believe was ACEs, TOOHIGH.com. Is that correct?
That's correct. Yes, an excellent place, and you can get your own ACE score there, and they've also got a questionnaire on resilience factors, which is an important flip side to ACEs.
Fantastic. Thank you so much, Dave.
Thank you. It's been a pleasure.
Dave, what final thoughts or key idea would you like our audience to take away from today's broadcast?
Well, I think the most important idea is that certain stress levels can be very high, and yet people may not recognize just how high they are. And if you've got symptoms that physicians are struggling to explain, it's worth looking into these sources of stress. And if you can get a deeper understanding of their magnitude, it may lead you to the path of healing, and chances for that are quite good.
Wonderful. So, audience, I want to thank you for listening, and I want to especially thank Dr. David Clarke for being our featured guest. And, audience, wherever you are and whatever time zone you're in right now, we want to emphasize to you how much we appreciate and trust that you'll benefit in some special way from the information that was delivered during today's show. Of course, as always, we welcome and look forward to receiving your comments. Please let us know if there are any additional topics you'd like to see us cover, or a guest you enjoyed whom you'd like us to invite back. Please contact us through our website with your feedback and suggestions. Remember, listeners, if you'd like to get the same benefits our coaching clients get with us, including learning how you can get more results in your day and easy ways to dissolve your chronic pain, stress, and anxiety, then give us a call at 954-900-2179, or you can email me directly at dr.bob@stressfreenow.info. That's dr.bob@stressfreenow.info. Mention that you heard our Stress Free Now podcast show, and you'll receive a free gift from us. Call or email us today to schedule your appointment. For Christine Wright, this is Dr. Robert Wright, Jr. of www.stressfreenow.info. Until next time, be safe and be well.